Regular eye exams are not only necessary, but can help save our sight. Even people who have been told that they have 20/20 vision need to schedule regular checkups since vision needs change as we age. With what's new in vision correction technologies, optometrist Dr. Jeremy Ciano. Good morning, doctor.
Good morning. Thanks, Mary, for having me.
It's good to see you. Let's start with annual exams. From your point of view, why are they so important?
It's so important for an annual eye exam not only to check the prescription for our patients to see if they can have better correction, when driving or watching television, but there's so many other things that we look at in an annual eye exam, looking for things like cataracts and glaucoma, diabetes, macular degeneration, and even systemic issues like heart disease, hypertension, thyroid conditions, things of that nature.
How prevalent are some of those eye-related issues you just mentioned?
We see ocular conditions all the time. Specifically, dryness is probably one of the #1 complaints that we're getting from patients nowadays, along with digital eye strain from so much overuse on our computer terminals and our up-close devices.
It's interesting because just this morning I said to my husband, I think I need to go see an optometrist. I can't see my computer screen very well anymore. I mean, this conversation now happened 2 hours ago at our house. In the U.S., a lot of people we know, they wear glasses or contacts. Any idea of a percent there?
Not off the top of my head. It varies from region to region and area to area.
What about some of what your patients are experiencing? You said dry eye and that sort of thing. And then I said off the top, corrective technologies. What's new to help patients who need it?
There's so many wonderful things at our disposal nowadays, especially in the daily disposable format for contact lenses. We're making a recommendation that patients can get a fresh, clean, sterile, healthy contact lens every single day. Specifically, there's a lens called the Dailies Total One contact lens, which gives a cushion of moisture. So patients are experiencing all-day comfort from the time they take the lens out in the morning, out of the package, and until the time they take it out of their eye at night.
What are you hearing from patients who are using those compared to what they might have used before?
You know what? Over 90% of our patients actually say that they can't even feel the lens on their eye, which is pretty remarkable for a contact lens.
Right. Instead of being one of those folks who's walking around all day with your finger in your eye and you're kind of rolling it around and messing with it. That's huge.
Exactly. I mean, our job is to make sure that we enhance the quality of people's lives, and lenses like that really help with that.
I'm thinking now about sports too and vision. We know vision impacts kids and what they do in the classroom, their success at school. What do you say to the parents of younger athletes or students where they're concerned that maybe their kids' eyesight's starting to slip a little bit?
Well, it's super important. We run a pediatric clinic, and we also work with athletes around the United States with specialty sports vision. And what we really encourage them is to get a great quality eye exam to make sure that their eyes are fit for all-day comfort, because when the contact lenses dry out, their vision suffers, and you need to have the same quality vision, whether it's the first inning of a T-ball game or the 9th inning of the World Series. You need to be able to see crisp and clear and be comfortable, and that's our job as eye care practitioners, is to ensure that for our patients and athletes.
And what about parents? Are there early signs if because a lot of exams, kids have to have that physical to go back to school, but throughout the year, are there early indicators where parents should say, okay, my child just isn't fussy, they're not being difficult, it's their eyesight that's the issue at school?
Yeah, a lot of times, but unfortunately kids don't know what they don't know.
Right.
And so I would encourage those parents to get them in for their regular scheduled annual eye exam to make sure that they're being screened for things like farsightedness, nearsightedness, astigmatism, things that can even slip through the cracks of those school vision screenings. But we want to make sure that they are performing to their optimal level so that they can learn and not be hindered because of a simple correctable thing like vision.
Is there a website, doctor, that has maybe more information about the contact lenses specifically?
For the contact lenses, go to dailies.com for more information.
All right, Dr. Ciano, thanks for joining us today.
Mary, thank you.
Thank you. Mike?